Okay, so Gary's in the chair, and we're going to do an implant in this area here, and actually for this tooth. So if we look at it, the very top, just come out a little bit. Don't zoom in so tight. Above it, it's not healthy. Go to the side here, see the purple? Yeah. Just come out a little bit, Deacon. Yeah, not so. Yeah, that's perfect. So you see the color there? The purplish, bluish. It's not healthy here, this tooth. So we're going to take it out. It shakes. When you pushed on it before, some pus came out. And we're going to put an implant into this area here. There's a one-step implant, two-step implants, and then temporization. I'll talk about all of them. So one-step implant means we take out the tooth, put the implant in right away. Two-step is you take out the tooth, wait a few weeks for healing, go back in there second time, put in the implant. Third step is, in terms of temporization, is what are we going to do with the missing tooth? So when Gary smiles, this is all he shows. Basically, that's it. So even if he won the 649, that's as much tooth as he's going to show when he jumps up for joy that he won tons of money. So is that, but he's not winning tons of money because he didn't buy the lottery ticket, but that's just not for here. My point is that worth $600-700 to somebody out there for temporization for 4 to 5 or 9 or 10 months? In Gary's case, I told him it's not really worth it. So he's not sure about it. I've had patients, it just actually transpired a few weeks ago, male patient, I took out the tooth, and of course, male bravado, plays hockey, he's into, tough guy. He says, I don't care, to be missing a tooth, but who cares? The wife cares. And that means when he came home and discussed it with his wife, the wife shot him back to the office and said, you're getting a temporary tooth, and that's actually what happened. He lives in Mississauga. So he had to drive another 3 hours or whatever it takes back and forth, plus the time in my office to take the impressions to make the tooth. But in this case, I want to save Gary as much money as possible, and I told him it's not worth $600-700. And being a retired guy, it's not worth it. So we're going to take out the tooth and put the implant in. Let's look at the X-ray here to the side here. So here's the tooth here, and there's a big defect in here. This actually had surgery done by a specialist many years ago, and finally the tooth gave out. But this is where the surgery was. It's a very tricky case to diagnose and kind of go forward with, but we really have been talking about it for a long time. So we're going to take out the tooth, and then this crest of bone here, we're going to put in the implant. So this, his nose, his nasal cavities for his nose, when you blow your nose, are right about here. So we want to tuck that implant in here. The size of the implant is going to be a 3.5 by 11.5. That means there's actually on the X-rays here that we took here, the 3D X-rays. Let's get a close shot of that. So I am using this company called Anterior, and it's a great company. And what's their job is? They have an oral radiologist that gives me a pristine, three-dimensional views and multiple views of the surgical site, so we can really plan out the surgery. So there's no guessing. So I know exactly what I need to do here. So if we go to 6-7, how Dr. Ingber plans this out, if we want to come really close, Deepak, let's just show this. So this is the sick tooth. I want the implant kind of more in this area here. So see this line here? See that line right there? That line corresponds to one line to the right of the longer line there. Can you see that? So if we just see the first longer line here, the one to the right, that's area number 6. Okay? So how do we read where that is? Right here, everybody. See number 6? And we get a reading from them 4 by 14.2 right down the center of that bone there. And you can see actually the base of his nose. See right here? See where it's dark here? That's his nasal cavity there. So when you have snot, when you have to blow your nose, that's where it's coming out from, through your nares, or your nose pipes there. Okay? If we go to number 7 here, so it's 6-7 area that we're going to place the implant in, more in the 7. And once again, we have a 4 by 13.1 area of putting the implant. So really, really good. Here's the implant on the bottom here. Celine, you want to pick that up for us? Show the front of it, please. There's the size. Turn it around there. And this is Zimmer company here. I love Zimmer implants. They're my favorites. I was using another company for many, many years, and they went out of business in Canada. So I went back to these Zimmers. I placed, I don't know, dozens or whatever, hundreds of these implants before. They seem to make more sense to me, actually, but that's more of an oral surgical level. Everything comes sterile. It's really, really impressive packaging. So when I do the osteotomy, we take it out through a whole protocol with all these special instruments down here to put that implant into the patient's mouth with ease. Okay, good. Excellent. That was even better than the other one.